Well, good afternoon. Today, we're seeing some sunlight break through the clouds. Daily case numbers are down. Transmission rates are down. Less people are being hospitalized. My friends, the measures are working. Staying home is saving lives. And I want to thank Team Ontario, every single person, for doing your part, for following the public health measures. Together, we are bending the curve. We're protecting our hospitals, and we're looking out for our most vulnerable. But my friends, we're not clear of this storm yet. Hospital ICUs in some parts of the province are still under immense pressure. We're getting hit with new variants of COVID-19, and there's significant delays in getting our vaccine supply. My friends, this is a critical time. We can find a way forward, but we need a plan that continues to protect the health and safety of each and every person in this province, while ensuring more businesses can safely reopen and getting more people back to work. Over the past few weeks, we worked diligently to put in place stronger measures to counter the alarming public health trends and fight the new variants. We issued the stay-at-home order. We launched several workplace inspection blitz, including a safety blitz at all big box stores. We've accelerated vaccinations for our most vulnerable seniors. We delivered a 6-point plan to help stop the spread of variants through the province. We brought in mandatory testing at Pearson Airport, which was critical and well overdue. And all of the enhanced federal border measures, including new quarantine requirements, will be in place very soon. We're allowing students to safely return to classrooms where they belong. And most importantly, we undertook a review of the COVID-19 response framework. My friends, we can't return to normal, not yet, not while our hospitals could still be overwhelmed. But we can transition out of the province-wide shutdown. Today, I'm announcing the declaration of emergency will not be extended past February 9th. We're maintaining shutdown measures in the majority of the public health regions in Ontario for a short time. But we will look to gradually and safely transition all regions to a revised and stronger COVID-19 response framework. Minister Elliott will share more details in a moment. For those business owners who are struggling, I want you to know that we listened. We've been working day and night to find every possible way to safely allow more businesses to reopen. And now we're taking decisive action. Under the revised framework, we'll be allowing non-essential retail businesses to reopen with stronger restrictions, including capacity limits, even in the gray lockdown zones. I'm confident with this revised framework in place, with mandatory testing at our borders and a strong plan to stop the spread of these new variants, we will be able to protect our people, our frontline heroes, our communities, and our businesses. But it's still up to each one of us, because we're not out of the woods yet, and I'm still concerned about these variants. We can't let our guard down now. And let me be clear, if we see the numbers spike again, we're prepared to take further action as necessary, because nothing is more important than protecting our people right now. So please, we need to keep bending the curve, and we need to stay home as much as possible. Let's keep small businesses open. Let's keep the kids in school, and let's protect our most vulnerable. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier. As mentioned, the collective efforts of Ontarians are having an impact. We've made some progress, including a decline in cases and percent positivity rates. As a government, we continue to introduce measures to protect the health and safety of our communities. Together with our hospital partners, we are expanding our capacity to respond to COVID-19, including a recent investment of $125 million to expand critical care capacity across the province. Yesterday, Mackenzie Health's new Cordalucci Vaughan Hospital officially opened its doors, where it will temporarily serve as a system-wide resource helping to alleviate capacity pressures faced by surrounding hospitals in communities hit hardest by COVID-19. And as the Premier mentioned, we have introduced our 6-point plan to protect our communities against deadly variants and are now screening all positive COVID-19 tests for known variants. However, I want to caution that while we have seen some progress, the risk remains high. COVID-19 variants are now spreading in Ontario and remain a significant threat to controlling the pandemic in all areas of the province, including those currently with low transmission. In Toronto, an individual has tested positive for the Brazilian variant. In Temiskaming Health Unit, a confirmed COVID-19 test has screened positive for a possible variant of concern. In North Bay, the Public Health Unit has identified a COVID-19 cluster, with one test returning a preliminary confirmation of a variant of concern. We must remain vigilant. To that end, we are moving to a regional approach and maintaining the shutdown and associated public health and safety measures, including the stay-at-home order, in the majority of public health regions across the province. As part of the Ontario government's commitment when announcing the temporary province-wide shutdown in January, the province will safely and gradually reinstate the COVID-19 response framework at the end of the shutdown. Effective February 10th, Hastings and Prince Edward Counties Health Unit, Kingston, Frontenac, and Lennox and Addington Health Unit, and Renfrew County and District Health Unit will be transitioned back into the framework. I know there were some reports over the weekend of Temiskaming moving back to the framework this week. However, with these dangerous variants potentially circulating in these communities, now is not the time to roll back public health measures. This decision is supported by the local medical officers of health. Subject to final review of the trends in public health indicators, all other public health regions, with the exception of Toronto, Peel, and York, will return to the framework on February 16th. Toronto, Peel, and York public health regions will return to the framework on February 22nd. There will also be new and modified rules to allow for the safe operation of in-person shopping at retail stores. This includes permitting limited in-person shopping in the grey lockdown zone with significant public health and safety requirements, such as restricting capacity to 25%. In addition, public health and safety measures in retail settings would be strengthened for other levels of the framework, as well as for organized public events or gatherings. As mentioned, we are taking a cautious approach to returning to the framework. If a region experiences a rapid acceleration in COVID-19 transmission, or if the healthcare system becomes overwhelmed, a new emergency brake can be implemented. Should this occur, the Chief Medical Officer of Health, in consultation with the local Medical Officer of Health, may advise moving a region into grey lockdown immediately to interrupt transmission. This is not a reopening or a return to normal. It's an acknowledgement that we are making steady progress. As always, it remains critical to continue following public health advice and measures to protect our communities, our most vulnerable populations, and stop the spread of COVID-19. Having all of these measures in place is essential as we continue to roll out COVID-19 vaccines, ensure that our hospital capacity is protected, and that we safeguard our province's most vulnerable. Thank you, and now I'd like to pass it over to Minister Jones.
Thank you, Minister Elliott. As the Premier stated, the declared provincial emergency will expire at the end of the day on February the 9th. While public health trends are improving as a result of the unyielding commitment to Ontarians, now is not the time to let our guard down. The risks of COVID-19 and new variants remain serious threats to our communities, and each and every one of us must remain vigilant. We remain in a public health emergency, and we cannot return to normal just yet. But we have charted a path forward to recovery. It is a roadmap towards the safe and gradual reopening of Ontario on a region-by-region basis. As Minister Elliott mentioned, that is why we have made the decision to maintain a stay-at-home order in most of Ontario, with the exception of 3 public health units. The stay-at-home order will be amended and individual orders for each public health region will be made. Stay-at-home orders for 28 public health regions will remain in place until Tuesday, February the 16th. As for Toronto, Peel, and York regions, stay-at-home orders will remain in place until Monday, February the 22nd. Let me be clear. Ontario's emergency orders will continue to be stringently enforced. Enforcement personnel have the authority to issue tickets to individuals who are found not complying with an order, and offences will be subject to fines and prosecution. It is critical that everyone continue to adhere to the orders and follow public health measures. Please stay home, stay safe, save lives. Stopping the spread of COVID-19 can only be achieved if we each do what we can to protect the communities that our families and friends call home. Thank you.
Ready?
We're ready to take questions.
First question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Mike.
Hi, Premier. Wanted to ask you about the changes to the retail rules when the stay-at-home order lifts and public health units go back to the color-coded system. There's a little more leeway for in-person retail shopping. Can you talk about what the thinking was there and why the feeling that these rules would be safe and appropriate?
Sure. Before I pass to the Solicitor General, you saw the numbers, Mike. I think everyone saw them. I just want to emphasize health and safety is the single most important. It trumps everything. We were seeing the numbers come down slowly, but you saw the numbers. The unemployment rate is 153,000 people lost their jobs. That's 153,000 families that are struggling to pay their rent or pay a mortgage or put food on the table. And we're going to do everything we can to help the small business folks, anything we can, but we have to do it cautiously. And when we go back to the framework, if you're in gray, you're in gray. If you're in red, you're in red, and so on and so forth. But we're just trying to give them a hand up. But again, it's the number one priority to make sure that we have a health and safety, safe community. And I'll pass it over to the Solicitor General.
So as the Premier mentioned, 25% limit, but it does allow, and frankly it acknowledges that we want small businesses to open. We appreciate that they can do it safely with that 25% limit, and the Ministry of Labour will continue those workplace inspections to make sure that the rules are adhered to. But we want to give people hope. We want to give people the ability to step up and be part of the solution. And in this case, it is to allow non-essential businesses to operate with 25% limits within their individual businesses. Thank you.
Follow-up?
Premier, when you look back to early January and you brought in the stay-at-home order, the modeling was suggesting that the ICUs were potentially going to be overwhelmed, and then that didn't happen. What do you think of the quality of the modeling that you've been given? Do you feel that it's been accurate? Has it been too pessimistic? Do you think any of the decisions you made were based on inaccurate representations, perhaps, of what was potentially going to happen?
Well, I appreciate the question, Mike, and it's a good question. I'd listen 100%, not 99.9%, 100% to Dr. Williams and the health table and all the other health leaders in our community, CEOs of hospitals, public health units. I talk to them frequently, and they give us the best advice they can at that given time. As everyone has seen, COVID-19 moves rapidly. With the new variants, it moves rapidly and is very fluid. What we do in January is not necessarily what we do in February or March, but I give all the credit, honestly, to the people of Ontario. If it wasn't for them, we wouldn't be in this situation. If the people didn't listen to the guidance and the protocol out of the chief medical officer, it would be it'd be a disaster. And there are still some hospitals that, yes, we've seen a little decline in ICUs, but we aren't out of the woods by any means. But I'd like to pass this over to Doc Williams, please. Thank you.
Yes, well, thank you. And as the Premier said, Mike, while the modelers had projected if we didn't put our measures in place, we would go well beyond 250 to beyond 300 to beyond 500, and then the whole system would be overwhelmed. We did not reach that because we adhered to the measures, we put them in place, and we've seen some bending of the curve. And yet, as the Premier said, and no doubt Mr. Elliott would add, that number is not down yet where we need it. We've stepped back from the brink, and some ICUs are still having challenges with moving people, and that is a challenge that's ahead of them in there. So we haven't yet got our number back down to under 150 to resume normal functions in our hospital system yet. So as the Premier and the Minister said, this is not a back to normal. This is not an opening up. This is a stepping back into the framework. But at the same time, it's stepping up to doing even more personal protection and care and caution in what you're doing, your masking, your distancing, your symptoms. Because with the variants of concern, we're finding more and more times that people who thought they're asymptomatic are actually spreading. So you're going to have to be more cautious than before when you do partake of some of these services, if and when they come available, and only when it's really essential for you to do so. So our task is still ahead of us. We're not out of this yet, but there are demands on the other side. We're trying to balance out between people in dire straits on both sides. But our success is in what people do personally, what they do in their homes, and how they maintain those disciplines and stay at the task so we can stay where we are and progress further.
Next question.
Next question comes from Randy Rath at CHCH TV. Please go ahead.
Hi, Randy.
Oh, yeah, hi. I'm sorry.
That's all right.
Randy, are you there? Okay, let's move to the next question.
We'll get Randy after.
Yeah.
He's a great guy.
Next question comes from Dave Woodard at AM 640. Please go ahead.
Hi, Dave.
Hey, good afternoon, Premier.
Hi.
My first question is, the provincial hydro rates relief is set to expire tomorrow. Has there been a decision made on whether that's going to be extended yet?
Yes, I believe we are going to extend it for a little bit longer.
Follow up?
Okay, thanks. Also, Premier Ford, in the Reopening Act, there's allowance for NHL personnel to have in-restaurant dining for some restaurants. My question is, why is it deemed to be safe for NHL personnel who are often flying into and out of different jurisdictions to eat at restaurants, and not for those people who haven't left their home cities in months?
I'll pass that to Dr. Williams. Thank you.
The rules with the NHL are very much strict with their protocols, with their frequent testing, their isolation of their players to the extent, and especially very tight transport within Canada. They do not leave the country, so they're staying in the province during this whole, or the country for this whole time. There are some players, of course, this is not their home and requires some place to have some eating and food facilities, and the NHL has procured that in a tight level of restriction and control. So that's all part of their bubble, if you may use that term, which they have strictly laid out in their protocol, and so far, as far as I'm concerned, they've been adhering to it.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
My apologies, Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. Just to cut through all this, there's a lot of information coming at the public.
Sure.
The majority of Ontario, it is essentially wait a week for another stay-at-home order for another week, and then let the numbers tell you where you are. So if someone here in Ottawa or someone around here who has to wait that week, they'll get an indication of where they're going to be if their numbers stay where they are now. Do I have that right?
Yes, you do. And for further clarification, I can pass to the Minister of Health. Thank you.
Well, we know that many areas are wanting to know where they're going to be, whether they're going to go back to green or where they are in the framework that we've already set up. But we need to watch it very carefully. We need to get the numbers down in our hospitals. In some parts of the province, the numbers are still very, very high. And with the variants of concern, we also want to see, for example, in North Bay and Temiskaming, what's happening in those units, how quickly this variant is going to spread, because health and safety of all Ontarians is our priority. And the variants of concern can increase the rates exponentially. So that's why we want to wait a week to see how those areas are going to do, and to overall get our numbers down so that our hospitals are going to be able to cope with the needs, especially in intensive care.
Follow up?
And just thank you. And just a question for the Premier. Anecdotally, I've heard people around stay at home getting quite fatigued with this whole thing. Are you worried about compliance? I'm not talking about house parties and keg parties. I'm talking about the families who want to have one friend over, those kinds of rule benders. Are you worried about compliance for another week, and in GTA another 2 weeks?
Well, I fully understand. I see it. I have it. My family has fatigue. Everyone has fatigue right now. And you know, I just want to thank everyone just for following the protocols. If we don't, we just seem forever before we get out of it. But we're doing so well as a province, and everyone is pitching in and helping out, and it's incredible. But just folks, just try to hang in there a little longer. We will get through it. We really will. And the numbers have come down, and proof is in the pudding. When we followed the guidelines and the protocol from the Chief Medical Officer and the health table, it works. You know, we could be going the other way. Instead, because everyone pitched in, such a Team Ontario effort, the numbers are coming down. And I'm very grateful for everyone's help in this, because no matter what the government does, if the people aren't following the protocols, it's just not going to work. And I can tell you the vast majority of people are. So thank you. I'm very grateful for that.
Next question.
Next question comes from Jeff Gray at the Globe and Mail. Please go ahead.
Hi, Jeff.
Oh, hi, thank you. Hi, Premier, Ministers, and Dr. Williams. I wanted to ask about the emergency break that you refer to. If I got it right, that this is a change from the process that we have now that involves the public health measures table and recommendations on who goes into what color, going to cabinet. The idea here is to speed this up because the variants can move so fast. Have I got that right?
That's correct. It's I'll pass it to the Minister of Health. But for instance, if you're in green and all of a sudden we see the UK variant, South African variant, Brazilian variant go into your community, it will switch. We'll put the brakes on immediately because it spreads so quickly, and put the brakes on. And I'll pass it over to the Minister.
Well, we do need to have that emergency break so that we can act very quickly in case one of the variants of concern takes off in a particular geographic area, and we know that the numbers can just increase completely exponentially. And so it's really important to have a mechanism whereby, the recommendation of the Chief Medical Officer of Health, those units can be put back into gray lockdown so that we can start getting the numbers down, doing the case and contact management, putting more emphasis on that particular region to make sure that it gets under control, not just in that particular geographic area, but in surrounding areas as well.
Follow up, and this will be the last question.
But connected to that, though, it's just a mechanism for moving to gray lockdown under the new scheme. There isn't a provision for moving to reinstate a stay-at-home order or that kind of, getting back to where we are now if things look bad in one region or another.
That's correct. Yeah.
Thanks, everyone.
Well, folks, just before we leave, I have to tell you a couple of stories what makes Ontario so great and people ask, how do you keep going? How do you keep going? Well, I keep going. I just have the people there behind us, and one of the questions earlier about if the people don't follow the protocols. But here's one example. I get about 2,000 to 3,000, probably closer to 3,000 letters and messages and emails in my office every single week. This one came to my home, and it just meant everything, and I get a lot of handwritten ones like this. The reason I'm bringing this out is when I read this, it just gives you chills. First of all, it goes through how this person that wrote me, first of all, is a senior. Her husband's a senior living up in Peterborough, and she was a nurse. He was an X-ray technician. Now he's had some health problems going to Baycrest, and just an incredible story here. I'm not going to give you their last names. I'm going to say Marion and Terry. I want to thank you for writing this letter. It's very thoughtful. But let me tell you what Marion has done. This is why I love the seniors. They've went through so many issues throughout their lives, be it the war and challenges, and new Canadians that have come here have went through some war-torn countries, and I've heard all these stories. And Marion, this is what I'm talking about, our seniors. She has made 2,900 masks herself. What an amazing person. But not only that, and I'm going to donate these to the frontline healthcare workers. Within the envelope, she sent me all these little Tim Horton gift cards, $10 gift cards for Dr. Williams and so on. I already talked to Doc Williams and Christine and the general. They want it donated. But when Marion comes down and brings her husband to Baycrest, she gets out of her car and she puts these on public benches to help people. Might be homeless people or whatever. Talk about the Ontario spirit. Just Team Ontario. I'm getting chills talking about it. These are hundreds, if not thousands, of stories that make Ontario the greatest jurisdiction in the world. So, Marion, thank you. Terry, thank you so much. And when you come down and we get through this, I'm going to have you by my office, but we're going to go down University Avenue and hand out these Timmy's card. Oh yeah, I got to give Timmy's a good plug. The best thing you guys ever did is make those real egg sandwiches. I used to go eat those other ones. They're the best, those real egg sandwiches. So whoever did that at Timmy's, good for you. And as for the Leafs mask today, lovely lady from Etobicoke made these in her house, and go Leafs go. What a champion. So again, great Ontario spirit. Thank you, Anna, for this mask, because my buddy Brendan Shanahan, he's tight as skin on a grape. He wouldn't even give me one of these masks, so I had to get it off someone. I can always bust his chops. He's great. Anyways, folks, all the best. God bless you, and let's keep the fight going. Thank you so much.